Hi, everyone. This is Shoshana Zatz from CIBHS. Welcome to the Small County Fiscal TA webinar with Mike Geiss. We'll get started in just a few minutes. Just want to give you a few updates and information. First, the Fiscal Leadership Institute is scheduled for June 4th and 5th. If you haven't already registered, please do so. We have limited space this time, so we are asking for each county to send only 3 representatives. And then in mid-May, we will reassess and let you know if we have space for additional county staff. The next webinar will be May 31st. As usual, Mike will be stopping throughout the presentation to ask for questions. If you have a question, please type it in the question box, or you can click the hand icon to let us know that we need to take you off mute and you can ask your question. And the webinar is going to be recorded and will be uploaded onto our website by next week. So that's it. And Mike, take it away.
Great. Thank you, Shoshana. Good morning. What we're going to cover this morning is the fiscal issues that were discussed at the last CBHDA Financial Services Committee meeting on April 4th. And you can kind of see the issues there, although obviously going into information notices and other fiscal issues is a deeper dive than just that. So the first thing that was discussed had to do with the SAPG quarterly federal financial management report. And I'm assuming you're all aware that changed as of January 1st to a cost reimbursement or retrospective reimbursement system rather than just a simple allocation. And so as a result of that, DHCS changed the quarterly reporting forms to reflect reimbursement. And DHCS recently published the third quarter, so January 1st through March 31st, 2019, the summary form and the detailed general ledger form that supports all the information on the summary form. And we'll take a look at it here, but you can see, and also there's a link that will take you to their forms, and you look under the, I think it's a SAPG, or it might even say QFFMR, and you can pull up these forms. So the top section, you're reporting your categorical funding that you should have been awarded in state fiscal years or state fiscal year quarters 1 and 2. So in other words, July 1st, 2018 through December 31st, 2018. However, on a cash basis, and this may have changed since the meeting, most counties had only received their first quarterly allocation and had not received the second quarter, which basically is when the federal government starts a new fiscal year, and the state wasn't authorized to release those funds. So, one question would be, are you supposed to report cash you receive versus the actual allocation? I would think it would be allocation, but I'm not positive on that because just the way the form flows, that seems like what would be appropriate to report here. And then you're reporting expenditures for the period January 1st through March 31st, and you're breaking it out into either federal fiscal year 2018 award or the 2019 award, based on these categorical funding lines. And like I said, the ledger itself is supposed to provide the detail that subsequently feeds into these categorical amounts. One of the questions was, what if you're not a drug Medi-Cal provider? You wouldn't have a drug Medi-Cal provider number. And And so, that question, I believe, was going to be asked of DHCS. And kind of the bottom line on this thing, from my perspective, is that ideally you're trying to set up your account code structure in your financial system to kind of correlate with these different, with the categorical funding as well as the service and program codes, so that hopefully fairly easily you can generate from your accounting system the amounts that you need to use to populate these new forms. And apparently DHCS had proposed hosting another webinar to address any of your questions. That may have occurred. I don't know. At the Financial Services Committee, it was advised that if you have questions, you should send those on to CBHDA. So that's the quarterly federal financial management report. Are there any questions? Or actually any additional information? Because that would be the other thing, is if anybody has any more recent information on some of these issues, please share.
Nothing yet.
Okay, I'm going to get rid of that. So then the discussion went into the information notices, which seems to be where many of the issues are being raised and identified. And so what I'm going to do, some of these didn't really have huge fiscal implications, so I'm just going to kind of cover them on here. But the ones that did, I'll go into additional detail. So the first was the information notice 19020 that was discussed, and really it adds a new data element in CSI to ensure that you're complying with some of the final rule requirements, mainly that you have a 10-day response time for non-urgent non-psychiatry appointments, and then a 15-day is the max you can have for non-urgent psychiatry appointments. The main fiscal thing here is that has to do with reimbursement, and you are eligible to receive state general fund reimbursement for the categories or activities identified here. So time spent training staff to enter assessment records into the system, your IT upgrade costs, and then again, time spent entering the data, not just training, and then time spent preparing and submitting assessment record data to the electronic health record. And so here, what you're going to do is report those on the 1982B form, your administrative claim form, under Federal Medicaid Managed Care Final Rule and Parity Rule. And the way that works is that basically 25% of those costs are then covered with state general fund monies. The other 50% is covered by federal financial participation, and then you're required to cover the other 25%. So that is what the information 19020 is about. The next one that I'm going to jump to is 19018, which has to do with the Drug Medi-Cal ODS provider selection review process. And really here, again, I guess there are some fiscal implications, but the main thing is that you're required, if you're under the ODS waiver, you have to provide or arrange for the provision of all the services to beneficiaries. And as part of that, you're accepting proposals from providers to enter into agreements to provide those services. This outlines a process that the providers can basically file an appeal with DHCS if they were not awarded a contract, and either they believe that you failed to award a sufficient number of contracts, or you use fiscal limitations, inappropriate fiscal limitations when establishing your network, or if it the provider feels that you did not adhere to your provider selection criteria when you award those contracts. And so, anyway, it just goes through a process where providers um, can appeal. The bottom line is if somehow you're found to be out of compliance, you have to come up with a corrective action plan in order to to adhere to these requirements. And the next one had to do with I'm jumping down to 19014, which just basically notified you that this uh, CADE, which is the California Association for Alcohol and Drug Educators, is allowed to register and certify alcohol and other drug counselors. So pretty straightforward there. Then we also had 19013, which talked about the revisions to the ICD-10 codes, which really just added two different codes for related to cannabis and substance use disorder. And again, not really any fiscal implications, but just part of the coding. So those are kind of just some of what I would consider information notices that were glossed over somewhat because there aren't real fiscal implications. So why don't are there any questions on any of those information notices?
No questions.
All right, then I'm going to jump into, so the rest, like I said, I'm going to go into a little bit more detail. The information notice 19019 talks about the program reviews that DHCS is going to conduct of your MHSA programs. And in that information notice, there are these are the counties that were identified, and obviously some of these have already occurred. In fact, Napa was able to provide some good information on the discussion. But the main thing is the focus is on compliance, and it's not a fiscal audit. They are going to probably ask you some questions related to that are fiscal related, but have more to do with whether you complied with your performance contract. And for example, some of the things that are in the performance contract include that you're supposed to submit the revenue and expenditure report by December 31st. So did you comply with that? MHSA funds are required to expand services. You're not allowed to supplant existing resources. And so they may ask you, and then also the distribution of MHSA funds between components. Those things are all in the performance contract. And here, actually, what's interesting is this, it just says that you distribute it based and basically reiterates the statute. It doesn't actually give you specific percentages. The only thing, there was some talk that, they can withhold funding if, as a result of this program review. I don't believe they can. I think the only thing they can do as a result of the program review is require a corrective action plan. So they're not. I guess they could withhold funds if you were deemed to be completely out of compliance, but that would be like you didn't submit a revenue and expenditure report yet. They could withhold funds, but I don't think their goal is to try to withhold funds. I think their main goal is to try to make sure you're complying with the performance contract. The one thing too I was going to point out is that Mariposa, there was the behavioral the MHSA boot camp that CIBHS put on, and you can find this on CIBH website, training and services, under I think it says past conferences. And Mariposa actually went through, and I didn't hear it, but they at least have a presentation that if you want to look, because they went through the on-site review the end of last year, and you can look at what their experience was, and again, if you're concerned about it, you can go and take a look at that. So that is the MHSA program review implementation information notice. Any questions or any comments on that? All right. Then the next information notice was basically 19017, which actually has some pretty significant fiscal implications. So because it brings about, it basically implements the changes that were made by Senate Bill 192 to the Mental Health Services Act, because SB 192 added some stuff to Welfare and Institutions Code Section 5892 and 5892.1, and this information notice goes through three of those. Basically, that you are required to submit a plan on how to spend reverted funds that were reverted and reallocated back to you through AB 114. It also had some things on the prudent reserve limit, which again, Senate Bill 192 implemented a maximum prudent reserve, and then it also addressed the allocation of interest. So specifically, in terms of plans to spend the funds, so this information notice came out when this came out in March, and it goes through that you were required to submit a plan on how you're going to spend all of your reverted funds by January 1st, 2019, because that was one of the changes that Senate Bill 113 made to the act. Unfortunately, they're kind of letting you know after the fact that you were supposed to do this, and I think that might have caught some counties off guard, especially counties who might not have had their entire reversion amount calculated when DHCS did some of the initial calculations, as well as if you made any adjustments to through a subsequent revenue and expenditure report. Again, that wouldn't have shown up in the reverted amounts, and as a result, you may not have complied with this provision to demonstrate that you spent all of, or how you plan to spend all your funds, and provided that to the OAC by January 1st, 2019. It then goes through, if you don't have a plan, what happens. You're supposed to send the funds back to DHCS, and basically says you can appeal, but really all it's giving you an ability to do is appeal the numbers and not the process. And so it kind of leaves you hanging if you didn't have something submitted to the OAC by January 1st. And so it's going to be interesting to see, because again, I think some counties were caught out by not knowing this requirement. The fact that DHCS published something in March that you should have done by January 1st isn't the greatest, especially since there was a prior information notice on dealing with the AB 114 reversion. So we'll have to see what happens, because again, like I said, I think some counties were caught out. The other thing that this information goes through, like I said, is the prudent reserve funding level. Counties so SB 192 established that you can have a prudent reserve that does not exceed 33% of your average CSS revenue received in the previous 5 years. And so what this information notice does is specify the 5 fiscal years. So they're saying it is fiscal years that you've already received funding, 13-14 through 17-18. And they tell you to add up the distributions beginning with what you received in July 2013 through June 2018, multiply it by 0.76%, because they're saying that is the percent that is of the distribution that's related to CSS. They say divide it by 5 for the 5 years, multiply that by 33%, and that becomes your prudent reserve limit or maximum of the prudent reserve. Excuse me. One thing on this, you'll notice that they started they say start on July 13th or July 2013. So what that means is you're going to have to actually, if you go to the state controller's office and look at the distributions, which again is what the state is going to probably take your information and compare to, you have to actually go back into 1213 because the state controller's office equates the July 2013 distribution with funds that were on deposit at the state level in fiscal year 1213. But the way I would do this, because you've got to basically do what they're calling an assessment as part of this or a calculation. And then you also have to certify on this DHCS form 1819, which I don't know if yeah, it's here, and you'll see it's a pretty easy certification, basically just saying that your assessment is accurate to the best of your knowledge. It's just the local mental health director. But you've got to complete those, the calculations in that form, and send it to both DHCS and the Oversight and Accountability Commission. And there's instructions for how to do that or who to send it to. In here, you can see here who you send it to. But basically, from my perspective, it's pretty easy. I would just, to demonstrate the calculation, I would just lay out the amount you received each month, starting July 2013, August 2013, et cetera, where you have 60 months worth of data, and show the calculations and show how you complied with their requirement. So again, that all needs to be submitted to DHCS and to the OAC by this June 30th. It is not required as part of that to actually go through a posting, but you do then have to include it in your, they say your annual update, but it could also be an update to your annual update would suffice as well. And then it goes through what happens if you have exceeded the 33%. You basically have until June 30th to move the funds from the prudent reserve and put it back into CSS or PEI if applicable. And it goes through how to calculate how much should go to PEI. And it's basically the way you would look at it is how much of your prudent reserve, how much of PEI did you put into your prudent reserve in 2007-8 of the total amount that was put into the prudent reserve through fiscal year 18-19. And that would be the percent that you would then transfer out of the prudent reserve to PEI. The balance would go to CSS. And then again, you include these amounts as part of your annual update, or if you're already in the process of doing your annual update and you haven't done this certification, I would just do it as an update to the annual update, which you're allowed to do as well. And then you're going to report the transfers on the 1920 revenue and expenditure report, so that you can show and document what you did. The other thing that is that's interesting, and this wasn't really discussed in the Financial Services Committee, is that there are proposed regulations for the MHSA that the DHCS has put out there for public comment. Those regulations actually conflict with this information notice in that the regulations say that when you pull money out of the prudent reserve that's in excess of the 33%, it all has to go to CSS. So hopefully either DHCS needs to issue a revised information notice if those regs get approved, or they need to change the regulations to allow for what they're talking about in this this information notice, because right now they're telling you to do one thing through the info notice, and really you shouldn't be acting on proposed regs until they're finalized. But like I said, they're in conflict. And then the last thing that the information notice covered was the allocation of interest. So again, something that was changed as a result of SB 192 was that it allows you to allocate interest based on where the interest was earned. So where in the AB 114 calculations, the state, I believe, was allocating interest purely just based on the 76%, 19%, 5% to the CSS, PEI, and innovation, irrespective of, you could have had a fund balance, for example, in workforce, and really some of the interest was attributable to the fund balance that you're carrying in workforce. SB 192 corrected what the state did basically and allows interest to be earned, and this tells you to basically distribute the interest based on the amount earned in each component, which would be based on the fund balance that you're carrying in each component. It doesn't go into detail, and the regs also do this as well. They don't go into detail on how you figure that out, whether you just figure it out on a quarterly basis, monthly basis, annual basis, looking at what's the average fund balance at a specific point in time. So it does at least provide you a little bit of leeway, but at least it's not subject back to that forced 76%, 19%, and 5%. But that also only applies to interest earned in the current fiscal year and in future fiscal years. So they're basically saying everything they did as part of the AB 114 reversion calculation stands, and you don't have to go back and reshuffle interest. So that is the gist of Information Notice 19017. Any questions on that? Obviously, hopefully you're going through the calculations at this point. On the prudent reserve, that's probably the biggest thing, because you're going to have to figure out those funds. The other thing I believe it says in here is that the funds need to come out in 1920, and 1920 counts as year one towards reversion. So you're going to have to look at that in terms of incorporating that funding into your expenditures in the future. So any questions on that information notice?
There's a question going back to Info Notice 19020.
Okay.
Can you claim for time spent for CSI on your cost report?
Yeah, so yes. So they're giving you the opportunity to put it onto the 1982B to claim for it on a monthly or quarterly basis. But then there should be a spot on the actual MH 1960 under administration, where you would be able to report costs related to to the federal federal final rule and parity rule requirements. I don't believe it was on there for 1718. They did put the continuum of care requirements on there, but so they should add a line to allow you to report these costs on the cost report. And if you look at the 1718 cost report and how they treated the continuum of care requirements, when you put numbers in there, it should flow through the same for this, and so that would support your reimbursement. Because you're correct, it's ultimately going to be you can do it on the claim form, but ultimately it matters what you show on the cost report, because that's what they're going to settle to. All right. Any other questions?
No more questions.
All right. We then had the next information notice, which is 19016, which talks about revisions to the drug medical ODS rates. So this basically is telling you you have the ability to update your rates, the rates that might have been in your initial plan. I'm not sure how many small counties actually implemented early, and many counties have not even implemented yet. But it does give you the ability to update your interim rates, and it goes through a process. But the one thing that is kind of interesting is, again, here we're looking at an info notice published in March, but you actually had to have your rate revisions to DHCS by February 1st. So it's kind of, at this point, I guess you would be submitting rate revisions for fiscal year 2021, which wouldn't be wise because you'd rather have more complete data. But it at least is giving you, I guess, a process, and it lays out the data, your updated fiscal plan template, the certified public expenditure data, which basically says you need to rely on your cost report for the most part, and then adjustments in the Home Health Agency Market Basket Index to bring those up to the fiscal year level. And then if you have revised projections on units of service and beneficiaries. And so what it's really doing is it's creating a 2-year lag between your actual data and your interim rates. And it was, as part of the discussion, one of the counties, one of the larger counties, was having some issues, and that seemed to be pretty specific to them, where things were either getting paid at a different rate than what the interim rate should have been, as well as things were getting denied. But it didn't sound like that was a system-wide. These were system-wide issues. So any questions there? All right. Then the next information notice has to do with establishing contract rates in the short-term Medi-Cal claiming system. And what this does, and for the majority of you, you're just not going to do anything. You don't need to do anything in response to this. But it gives you the ability, if you want to establish a limit on the interim rates that are paid to your contract providers. And you can fill out this form, which then limits the rates, this form here, and it limits the rates for your services to all the contractors. And so basically it's a limit that applies to all contractors. So you're not doing a separate one for each individual contractor. And again, for most of you, you're hopefully claiming for your contract providers at the rates that you're paying those contract providers. That's the intent. That's the goal. That is legitimate. And if you're doing that, you don't need to even worry about this information notice. This information notice is really set up, or this process, when you may allow, for example, a contract provider to put their own rates into the claims processing system, and you want to limit the amount that they could claim to a certain amount, which is what you're paying them. And so in those situations, you would complete this form. The way that the process works, the processing of the claim, is it looks at the rate being claimed versus the max that you would have plugged in, and it will reimburse the FFP based on the lower of those two rates. But again, it for most of you, this is not relevant. And again, keep remembering these are interim rates. Basically to provide you cash flow, and that ultimately it all comes down to the cost report and looking at providers' costs, and their charges, as well as the certified public expenditures that you incurred paying the providers. They're also, and it wasn't in this information notice, but there's another information notice that the state generally issues that talks about the county operated provider maximum rates or interim rates that the state applies. And that is supposed to be based on your most recently submitted cost report adjusted for inflation. Again, with inflation for all outpatient services being referenced as the change in the Home Health Agency Market Basket Index. But it sounded like that maybe there were some issues there where the state may or may not be using the most recent submitted cost report. They should not be using or waiting for an audited or settled cost report. So I'm not totally sure what's going on there, but definitely something you want to keep an eye on, especially as your costs go up, that the state is in fact calculating those maximum rates. And this is all posted on DHCS website under the MedCCC library. So any questions on that? All right. Then the discussion went into county to county issues, and so I just generally put the title of those without going into a lot of detail, and so then I can talk to you guys about it. But apparently, so the allocation of MHSA revenue and interest, San Diego had some concerns with basically the approach used by DHCS as part of the AB 114 calculations, where they applied, like I said, the 76% to CSS, 19% to PEI, and 5% to innovation. That is basically assuming that innovation is funded proportionally from CSS and PEI. And so I believe San Diego's raised the issue, and I don't believe DHCS has addressed that issue as of yet. But I will say one thing: in the MHSA proposed regulations, that the regulations specify the 76%, 19%, 5%. And in the initial statement of reasons, DHCS said they did consider, using a different approach where the 5% could be funded however the county wanted to. Which to me means that it is a valid to consider a different approach. But ultimately, they came back to putting this into regulations in order to be able to calculate reversion uniformly from county to county. So it'll be interesting to see if the regs go through. But the other part of that is regs generally are not retrospective; that they can only apply to things going forward. And so you're going to have this period from fiscal year 11-12 through, at least through 17-18, probably 18-19, where there wasn't anything in place. And it'll be interesting to see what comes out of that. And again, the downside on some of this is there's no place to appeal, and so it often ends up having to go to the courts to have it litigated. CBHDA made some recommendations around the prudent reserve, and this, as well as a bunch of other CBHDA recommendations, there's concern that they're not being considered by DHCS. I think there was a belief that, especially when folks read, the implementation of SB 192, that some of CBHDA's thoughts were not really considered. So, and that was true in some other instances as well. So, but now this is out, and so at this point, you pretty much have to comply with it. The co-practitioner claiming there was a letter sent in June giving a verbal implementation date of May, but basically still waiting again from a response from DHCS, because counties don't want to have to apply this retrospectively. Then on the cans in the PSC 35 state general fund allocation methodology, again, CBHCA is recommending a flat kind of rate, and is basically still waiting on DHCS. Same with the Meds Light, trying to get SUD providers and contract providers access to a Meds Light. And I believe there was a conference call that already did happen on that, so maybe there's resolution to that. Then we talked a little bit, or it was discussed a little bit about an interesting approach from a DHCS auditor on their interpretation of direct costs versus indirect costs. I should say their interpretation of indirect costs, where the auditor was saying all the county's indirect costs need to be reported as administration. And really, there's a couple of parts to that. DMH actually issued this letter saying that is not the case. And in fact, one of the discussions, I believe, at the upcoming Fiscal Leadership Institute from DHCS on their policy, it basically reinforces this same concept of that if you have a cost that cannot be identified specifically to one of the cost objectives, and there's basically three cost objectives, which are either services, administration, or UR, utilization review, then it becomes an indirect cost and needs to be allocated, appropriately between those. So to say that, for example, your countywide cost allocation, your A87 costs need to be considered administration is totally inconsistent with this DMH policy letter, as well as what it sounds like DHCS is going to discuss at the Fiscal Leadership Institute. And in the discussion at Financial Services Committee, it sounded like the auditors are saying that they believe the policy is incorrect. And so that's going to raise some huge issues if all of a sudden you've got auditors basically saying that the state's policy is not correct, and could easily lead to litigation. So it'll be interesting to see what comes out of this. The other thing, though, I will point out is that this letter, you'll see the date. It's in September 2011. So we were into fiscal year 11-12 when this came out. Even though the cost reports changed in 10-11, this letter didn't come out till 11-12. So it could have been that the auditor is saying, okay, through 10-11, we're still going under the old rules, which were that indirect costs were considered administration, and then beginning in 11-12. But it did sound like one county had the same audit finding in 11-12, which again is inconsistent with their own policy. So probably more to come on that. Then there was a discussion about AB 539, which has to do with the redirection of MHSA funding for the Workforce Education and Training 5-year plan that has already been approved. And the language did change, and so it's now saying 15% of revenues in excess of $1.9 billion would go to fund the WET 5-year plan, after accounting for the No Place Like Home debt service payments, and limited to no more than $300 million in aggregate over a 5-year period. What that means dollar-wise, given the current revenue projections, that would mean about $45 million would be taken out for this purpose in next fiscal year in 1920, and about $77 million in fiscal year 2021. So we'll see where that goes. But I got the impression that CBHDA is in support of this piece of legislation. And then there was a discussion around, actually it wasn't even much of a discussion, it was just a mention that you're going to have, the OIG recoupments for fiscal year 13-14 claims where the OIG had findings and then extrapolated that to the overall population, and everybody is getting hit with, well, not everybody, because I think there's 2 counties two of you small counties that aren't because your share of the claims were immaterial. And so they are going to recoup that over 4 years. They're going to offset your 1991 realignment with the amount of the recoupment. But the thing is, you may want to consider that using some of your MHSA funds to pay for the recoupment as well. And one approach would be to look at, of your total fiscal year 13-14 approved Medi-Cal claims, what percent of those were in MHSA programs, and then further you'd look at how much were CSS or PEI, and then allocate the amount of your recoupment back to MHSA based on those percentages. And I would think that would be very valid, for the purpose of again using some of the MHSA for the recoupment. Now, if you don't have any Medi-Cal, or you didn't have any Medi-Cal in 13-14 in any of your MHSA programs, that would not be appropriate. But if you did, then I would definitely consider doing something like that. And then basically nothing new, I guess, on the 2020 waiver. The two waivers, the 1915B, which is the Medi-Cal Especially Mental Health waiver, expires June of 2020. And then the 1115 waiver, which is for the ODS, drug Medi-Cal, that expires December 2020. It sounds like DHCS is working internally on proposals, and they intend to hold a public stakeholder process late summer, early fall. So we'll see what comes out of that. Then it was brought up, this Assembly Bill 43, which talking about open meetings and how it would basically require kind of almost full disclosure, well, not even full disclosure, basically open meetings for any sort of planning related to innovation projects. But I'm not sure what folks were aware of when you actually look at the bill, because I think it was amended. And hopefully this is on your guys' radar too. But it basically authorized the commission, which is the Oversight and Accountability Commission, to start to develop strategy for collection, organization, and public reporting on information of mental health funding, revenues, expenditures from MHSA and other sources of mental health funding. So basically, I look at this legislation as a kind of giving the OAC carte blanche to ask you for whatever, even though you're already doing a ton of, the cost reports and the revenue and expenditure reports. So it'll be interesting to see where this goes, and I would assume CBHDA has a position on this piece of legislation. Then talked a little bit about there were network adequacy. There were 11 counties that were contacted by DHCS for not complying with the network adequacy requirements, and that they're facing financial sanctions. Many of those counties submitted corrective action plans back in December, but then they received notice from DHCS about the sanctions without really even any sort of reference to the corrective action plan. So the question is whether DHCS is in fact paying attention to these corrective action plans, and that they are they doing any sort of analysis on the compliance then, rather than just looking at financial sanctions. Then there was brought up, the calculation of the MHSA FSP percentage. So hopefully you're all aware that this is from the OAC's website. They now have this fiscal transparency website, and it goes through, and you can do all sorts of stuff. One of the things is on the full service partners, and you click on that, and it goes through this percent of CSS expenditures that are on FSP programs. And actually, that's an interesting term. I just noticed they used allocated. So I don't know what they're trying to do. In any case, my understanding is the way that they're calculating this is that they consider CSS administration in the total, but then they don't split it between how much should be FSPs versus non-FSPs in these calculations. And really, I don't know if there's anything you can do at this point other than note what is on this website. You hopefully you're aware, like I said, that this is here, and you're going to want to take a look at it in case you need to defend this in front of any of your stakeholders. Then a question was asked about what the annual adjustment was that was going to come up and get posted this July. This is the accrual amount, and after the meeting, it was the calculation letter was sent out to everybody, showing that it's $443.6 million, and that will be posted on July 1st, 2019. That's a little bit higher. It's about $30 million higher than what was in the January budget, and so it's a good thing. It seems that the Department of Finance is getting much better at estimating this when they do their January budget, where previously they were off by as much as 50%. They seem to be getting at least pretty close now in terms of estimating as part of the January budget. So good news there. Then there was a brief mention that DHCS is going through reorganization effective July 1st, and that there's going to be 3 different divisions: a community services division, a licensing and certification division, behavioral health finance division, and a Medi-Cal behavioral health division that basically incorporate a lot of the behavioral health oversight activities that DHCS does. And again, CBHDA sent out the PowerPoint that DHCS went through on that, but we'll just have to wait and see what that looks like and how it goes. And then the last thing had to do with a county brought up that DHCS is calculating the disallowed units of service. They were actually removing them twice in their calculations. And again, so you're going to want to double check as you go through audit and see, the county provided an explanation, and again, that was sent out by CBHDA. But you're going to want to go through and look at any audit report to make sure on their units of service calculation that you can kind of track them and that they're not excluding the disallowed services twice and double penalizing you for those units of service. So that is it in terms of what I was going to discuss this morning. Are there any questions on anything I just talked about or anything else? We've got 5 minutes here.
There's one question going back a ways. Do you have any comment on counties that may have used the distribution percentages of 75%, 20%, and 5% for MHSA revenue?
So from my perspective, even though DHCS is proposing regs that puts the 76%, 19%, 5%, like I said, DHCS admits in their initial statement of reasons that using a different approach is valid. So, the question is, what do you do with it? So, yeah, so they're admitting it's valid, but they went ahead and applied, those percentages when they calculated the AB 114 amounts. And so what would I say to you? So clearly, beginning whenever the regs take effect, you're going to be forced into this 76-19-5 unless that gets removed from the regulations. So you're going to have to change and go to 76-19-5. But what you did previous to that, I don't know if I would do anything to those amounts. I wouldn't retrospectively go back necessarily and change those. But you probably, and maybe it's more of a CBHDA issue than just individual counties, or at least maybe within CBHDA counties that did use a different approach should all get together and decide how you want to proceed. Because it may again require some sort of litigation against the state, which I don't know if it's worth doing. It depends on obviously the impacts on reversion of having to redistribute it based on the 76, 19, and 5. But if it is a big and would result in a different reversion calculation that's significantly different, then yeah, I think those counties and maybe CBHDA wants to take a poll, or maybe they already have as a result of that San Diego letter, and those counties should get together and talk strategy and what they want to do, because again, once these regs go through, if they go through as proposed, you're not going to have a choice. But like I said, prior to that, there was no guidance saying you had to do it this way. And so, I think the state would have a weak stance to try to say that you had to do that, when in fact they're even admitting in their statement of reasons that it's a valid consideration. So again, at this point, I wouldn't do anything other than potentially pursue it through CBHDA, but plan on having to change that once these regs are go through. Again, unless that gets pulled out.
Another question. Can you please discuss again continuum of care in mental health 1960 and MH 1982B claim form?
So on the cost report itself, there's a portion. So on the MH 1960, if you look at the fiscal year 17-18 forms, there is a spot so you have administration that you then need to apportion between Medi-Cal, I think it's MCHIP, non-Medi-Cal, and then in 17-18 they added a spot for continuing care administrative activities, and so that is where you're going to report those costs on the cost report, and then the way it flows through is that it actually gives you reimbursement for state general fund reimbursement for those costs. So basically says, the FFP is 50%, and then of the remaining match, 50% is local, 50% state general fund, which works out to be overall funding ends up being 50% FFP, 25% state general fund, and 25% local. And that's how it flows through the cost report. That also is, I believe, how the 1982B, when you report costs, so the 1982B is your administrative claim form, and when you report costs that were incurred dealing with the Medi-Cal final rule and parity rules, that same calculation, I believe, takes place on the 1982B, to where it's going to give you 50% of the FFP, and then of the balance, 50% is going to be state general fund. And you'll see that on the 1982B form. But right now, I don't believe that they included a line on the 1960 for the final rule. So you couldn't have done that in 17-18. I guess you could have fudged it and said it was continuing care reform. But hopefully they add a line for the 18-19 form, MH 1960 form, to allow you to do that. In there, you're going to report your actual costs. And it's not just the activities that I talked about here. You're going to want to refer back. There's a bunch of other requirements, and they need to be new costs, so you can't just like repurpose somebody to do something and call it a new cost. It needs to be you're incurring additional costs, and if you are, then the state's supposed to share 50% in the burden of that with you. So hopefully that helps.
There's no more questions.
All right. Well, we're at noon, so that worked out well. Okay, so as Shoshana said, we've got the next call, and we'll probably discuss the May revise a little bit, at the end of May, as well as then the Fiscal Leadership Institute. We'll also probably get into that a little bit more as well. But yeah, that's all I have.
All right. Thank you, Mike, and thanks, everyone.
Okay, bye-bye.
Bye.